Welcome to Bite Size Dental Marketing. Today we are having a different kind of session. We're having the second of our HTTM, how to tactically market. And today, as always, the lovely Andre Santos. Andre, thank you so much for jumping on with me today. You wanted to talk today about the tactical differences in fee-for-service marketing versus a PPO practice. And I think by extension, we'd probably get into how a Medicaid practice may differ from PPO just tangentially. But give me the overview. What are your thoughts on the topic?
Yeah, before I even get to that, I want to say, the reason why we started this segment is because we want to add value. We want the people listening, the doctors, the team members listening, to be able to walk away with actionable items that they can implement in their practice. And the reason why I suggest that we talk about a fee-for-service practice today is because we're seeing this shift in the market where we're getting contacted and hired a lot more so today than ever to do exactly that, to help practices move out of network
Mm-hmm.
from insurance, get out from under Delta and some of those other plans. And so we thought it made sense to give them some specific action items to accomplish that. Now, I'm going to go back a little bit on our word and say, I don't know that there's these really different tactical items as it relates to fee-for-service practice. Think of this as playing a sport. Let's say you play basketball and you play at a local level or a regional level. You're doing the same things. You're dribbling, you're shooting, you're passing. But to play at a national level, you just have to be a lot better than average. You have to do the exact same things, but just at a higher degree of excellence and quality.
Mm-hmm.
And so you can think of marketing a fee-for-service practice versus a PPO or even a Medicaid practice, some capacity the same way. The things we're going to talk today, they're not unique to fee-for-service practice. We're just going to emphasize how you need to do them differently or to what degree is expected because of the experience that a patient that is paying out-of-network costs expects from a practice. Does that make sense?
It does. I like the basketball analogy. And when I think about it, I like that a lot. I think a Medicaid practice is competing with other Medicaid practices, right? Because you're assigned a patient. I think a PPO
Mm-hmm.
practice is competing with, by and large, other PPO practices. I mean, do you take my insurance is probably the biggest barrier. I think, to use your basketball analogy, I'm no longer playing against the people in my neighborhood. I'm playing against now other events. And I think a fee-for-service practice, I think your sort of competition is some PPO practices, certainly, because, I think they're dentists. I also think you're competing with my discretionary income and how I choose to allocate it, my priorities. But
Mm-hmm.
I really think you're competing probably with my education and not my, computer science degree or whatever I may have. You're competing with my education around the dental industry and dental insurance. And, I think I like your sports analogy because, as you move up, you're not doing anything different, but you are practicing longer. You are certainly putting more time in. You're practicing for purpose, not just, I got to go to practice.
I think the very first one you've already touched on, which is the phone. And that one question, do you take my XYZ insurance? I think PPO practice also answers that question, but they get to answer yes a lot of the times, which makes the game a lot
so
easier.
easy. Yeah. Yes, we do.
Right.
Yeah.
Yep. What's your next available appointment? Great. Now, I think a fee-for-service practice, and that's again the education point, they have to have a plan to how they're going to answer that question and talk about, yes, we are, able to see you. We're an unrestricted provider, and we're not coaches, so I can't give you a play-by-play on what exactly to say. But the message that the patient needs to feel is that you do see them there. There's a lot of other patients who also have the same insurance that come there because there's that safety of I'm not the first person that's coming there and trying to go outside of the lines. There's a lot of other people who are like me who come there. And you got to give them this comfort that dental insurance is not the same as medical insurance. And a lot of people's knowledge of insurance in the medical space trains them that they can't really go out of network, as well. That's not really the same in dental. So I would say the number one step or tactic or advice is have a plan for answering the question, how do you take my insurance, and make sure that the patient knows that they are welcome there. And there's a lot of people who have that same plan who come there. And I'll add one more thing. Explain to them how it will work, what was going to happen on the first visit,
Yeah.
how are you, what's expected of them in terms of payment, if you're going to file the insurance for them or help them file, and the reimbursement. And this is a little different per state and per carrier. But if you can explain to them in very simple terms, yes, we do, and here's how it's going to work here, I think you have a lot better chance of converting those patients.
I had Catherine from Lions speak on a few months ago, and she worded it so wonderfully that you need to get behind the question and not just answer the question, yes or no. The question is, gosh, do you need a lot of work done? Is that why you're asking? Or somehow be interested in why they're asking the question. And I do find that a fee-for-service practice tactically, but I do think a PPO practice can get away with a busier front desk. I think a fee-for-service practice, when that phone picks up, you need to be patient and loving and absolutely try to get to know the human, because you're no longer an order taker, you are in a sales role.
Mm.
And I think that tactically, if they could get that front desk dedicated to when that phone rings, that is where their attention is. Don't try to multitask. Don't try to check someone out. Don't try to do, field that question. I think is probably underrated in today's short-staffed, always busy environments that we're in. And I would like to see them slow down.
Is that 1A or is that 2? Taking
I don't know.
your time.
I will tell you, I'm the guy who's like, oh, point number 1, and then I'm like, point B, and then I'm point 2C. Yeah, no. I'm not the guy to keep count on these things. But I'll go with 1B.
All right, let's go with 1B.
Yeah.
All right. So I think number 2, and again, this is important for every practice, but it's a lot more important for fee-for-service practice. You have to have a really nice looking website and online presence, but not just beautiful looking. It has to feel personal. You have to build the connection as best as you can with that patient before they've even been to your practice, to give them that sense of warm and fuzzy, that this is a really high class office. It doesn't have to be high end and expensive necessarily, but that the people there are there for a long time, that they care about their patients. And the best way to do that is 2 things. Number 1, do away with stock photography. You can get away with it if you're a Medicaid practice. You can somewhat get away with it if you're a PPO. But if you're fee-for-service, I think the bar is higher. You need to have your own photography for the website. I've said this tip many, many times. Hire your friend or your family photographer who does your Christmas photos or whatever the case may be to come and just get some pictures of you interacting with your team, interacting with patients, and being who you are. Don't change who you are. Don't pose in a fake way. Just be who you are. But get that original content that makes it changes the feel of any website tremendously. And paired with that, I do think you need to have some video content of you talking directly to the prospective patient, introducing yourself, telling them about who you are and your approach to dentistry and what makes it unique, what kind of experience you want patients to have. Because I think that is how you can connect and make people intrigued to pick up the phone and call.
Yeah, I can't say enough about that. I think we're buying the experience we're not really looking for a dentist. We're looking for the experience that a dentist provides us. And that comfort of seeing who I'm going to meet. And if you don't, practice in a suit, don't wear a suit for your pictures. If you practice in scrubs, wear scrubs. If you're business casual, wear business casual. But I think you need to think of it as a way to accelerate that connection, that when I see you, I know what I'm getting myself into. Yeah. And, to build on that, I think you need to capture patients in the same way. I think knowing what I'm getting into is one thing, but seeing other people like me on your website, seeing other people like me on your social media, I think also endears me to, this is a place that I want to associate with. And I think getting the patient testimonials, and I know that, cascades down into reviews, but getting the patient testimonials, I think, is also very, very important, because I want to know that you worked on people like me, that people like me go there. And the association of it, I think, is very powerful as well.
It's very true. And I think there's a level of trust and connection that comes from the doctor talking to the patient directly. But there's a whole other level of trust when a third party that's, obviously you're talking about your own business. You want people to come there. But when a third party person is willing to vouch for you, that carries quite a bit more trust in that prospective patient's mind. And funny enough, I was just having a discussion the other day about trends and how the marketplace is changing. So consider this 2B, if I'm keeping track of it
Okay,
correctly,
I like
on
it.
the content there. If you can get user generated content around your practice, what this means is have some of your patients take their phone, selfie mode style, and have them record themselves as they get out of the car, as they come to the front door, as they are welcomed by the practice, and they're touring the office, and they're sitting on the chair, and they're waiting for you. Like, really document that experience. That kind of content right now is the most powerful kind of marketing content because it feels super, super authentic. Again,
Yeah.
we do patient testimonials all the time. We've been doing them for a long time, but it's usually in a more controlled environment. We have lights, we have questions prepared, and all of those things. But when the patient is sort of in a raw way documenting their journey, the other people watching that content really connect with it. And so I know it's a
They
little
know it's
more.
authentic.
They know it's authentic. So I know it's a little more challenging sometimes to convince patients to do it, but you can start with a friend, a friend or a family member, just to get one that you can then show other patients. Would you do something like this for us? And the reality of it is, if you are a really, really well-ran practice and your patients love you, they want to help you. They're grateful, they're thankful for the work you've done for them, they consider you as a friend, and they want people like to help people that do right by them. And so I don't think that the patients will be adverse to doing it, but most people don't know how to do it. So if you can do one example for them and say, show it to them, say, hey, can you do something like this for me? They would. And it's super powerful when it comes to marketing. And it's even more so impactful for those fee-for-service practices, especially if you can have them talk about they thought they were a little unsure about how it was going to work because of the fact that they have XYZ plan and you're out of network, but the experience was super smooth. The front desk person took care of all the paperwork. They just had to effectively pay up front and get reimbursed later, but it was totally worth it because it's an experience like they've never had before. I think that's the marketing gold, and that's the tactic right there.
Yeah, very well said. Now, what's point 3 for you?
Point 3, to me, it's reviews. We talk about reviews almost in every topic that we talk about, how those are important. But I think, again, for a fee-for-service practice, it's just a lot more important. If all your competitors have 50 reviews and they're 5 stars, I want you to have 100, 150. I want you to not just be a little bit better, I want you to crush it. And I want people leaving long comments and praising how the experience is because, like you said earlier, the experience and what is it like being a patient there is one of the most important factors. I mean, obviously, being a clinically good dentist and taking care of business, all those things are important, but a prospective patient doesn't know those things yet. They haven't been there.
Right.
You're trying to create that feeling in them before they've ever had a chance to meet you face to face. And the reviews and that social proof and the validation is really powerful. And there's the power in the numbers. If a lot more people are choosing you, it must mean that you're worth it.
One thing that I think that dentists, there's many things, something that I think dentists need to understand when they think of their patient base and how well they connect and how they treat them like family, whatever they tell themselves, they're leveraging the information they have after they've been a patient for some period of time. They're not actually putting them shoes of someone looking at their practice for the first time and not knowing their personality, not knowing anything about them, and just judging practice number A and practice number B from each other. I said numbers, but that's it. And if you put yourself they don't know you. They don't know that you're clinically a better dentist. They don't know that the other offices don't take care of their staff the way you do. They don't. None of that is known to them. And I think finding ways to connect are so impactful, but a patient only knows what they know at the point they know it. They don't know that you're an amazing dentist. They don't know that you're a great guy or a great girl. They don't know that. They know nothing other than what they see. And I think reviews play such a huge part of that because they're the original user-generated content, and we do trust Google when it comes to reviews. And if I can see the reviews and I can see, the pictures on the site and I can see other people let me go, that does now make me open to going there and learning more about who that doctor is and what she represents.
Yeah. And to complete that point there, some tactical advice: go sign up for a tool like Swell or
Mm.
Bird Eye or Podium that plugs in directly to your management system and that sends an automated review request at the end of the day to everyone. And and you can even segment it by procedure code and like comp exams, those things. But oftentimes practices are scared that they're going to accidentally invite a negative review. Don't be.
Uh-huh. Yeah.
If you are running a fee-for-service practice, great care should be table stakes. That's not something you're worried about. All of those tools still have a way to prevent a specific individual from receiving a request if you really are concerned. And if you've thought about it before, but you thought, my front desk does a really good job asking, they'll just send them, they'll show them the QR code and all those things. It just is not sustainable. I'm not saying you shouldn't have the QR code and you shouldn't have the team talk about it. You personally should be talking about it as well. However, the safety and the consistency of having a tool doing it every single day in the long enough time run outperforms the manual processes every time. And
Yep.
it's a worthwhile investment. Before anything else, it's one of the most impactful marketing tools and expense line items, if you will, that a practice can implement.
Yeah, I agree. It's well
And
said.
I have one more, Eric. I have one
Tell
more.
me, is it a
Uh,
bonus? Is this
it's
4 or 3 bonus?
it's bonus because I
Okay.
don't know that this is a requirement, but I think it's really, really nice and important. And that is having an in-house membership plan. And the reason for that is because you're telling patients already that you're not going to be able to use their benefits the way they're accustomed to. But if you do the education piece that we talked about earlier, and they understand how their dental insurance really is almost like a discount plan, not true insurance, the way that your homeowner's insurance is insurance, and you can get them to become a member of your in-house plan, there's a couple of things that happen that come with it. Number one, because they've already prepaid for their hygiene appointments, they're more likely to stick with it.
Yep.
The loss aversion principle of human nature, people are a lot more concerned with losing something than with the possibility of gaining something. If you give someone a bet of flip a coin, if you win, you win $100, but if you lose $100. People won't take it because they're more worried about losing the $100 than the potential of gaining that money. And so when people pay for their cleans up front, they don't want to lose them, so they show up. If they show up, that means that fewer patients fall off your hygiene schedule. It also means that you get more opportunities to diagnose treatment and make sure that they're healthy. So a lot of benefit and good things happen when those patients have the membership plan. And if you're worried about the discount side of it, because most membership plans, when you sign up, there's a membership fee. They get 2 or 3 cleanings included, so on and so forth. But then they also get 10 or 15% off of treatment. Note this: patients who have a membership plan, on average, do almost twice as much treatment as patients that don't. And that is the Costco mentality. When you go to Costco and you perceive everything to be on discount, you buy more. And so when patients have a membership plan, they know they're getting a deal, they tend to do more dentistry that perhaps they wouldn't do otherwise. And so it's an overall plus for the practice, and it gives you that stickiness with the patient as well, because if they're a member of your plan, they're not switching dentists because they switched jobs or they had a life event and they changed insurance plans. They're sticking with you because they're part of your membership plan, your tribe, so to speak. So I really think it's important. It's not a deal breaker, but I think it makes a huge difference for fee for service practices.
I agree, and I think making it part of the culture is as important. I think if you have it and you're not talking about it with almost every new patient, why are we doing it? I think it needs to be part of the culture, and I think it needs to be part of the education around it. I think you nailed it.
Yeah. And
Well,
if you're not
on
sure
to
how to, if you another tactical advice here, if you're not sure how to implement a membership plan and you're worried about keeping track of who has it, who didn't, who's going to use it, who hasn't used it, there are tools out there that effectively manage all that for you. Tools like Subscribely, where they take care of the management of the plan, they integrate with your PMS, and they can tell you which patients have already used the benefits or not. So there are easy ways, air quotes, to do this where it's not managing it on an Excel sheet that can make your life easier and still get all the benefit of having the plan. And so that would be the last advice there.
Now, Andre, would you mind summarizing the 3 points and the bonus point for me real quick?
Yeah, so number one, we started with the phone. Have a plan to how you're going to answer the question if they take their insurance. Make sure that your front desk is not rushed, that they have time to welcome the patient to the practice. Reassure them that they made a great choice by choosing you. Brag a little bit about your team and your doctor and just give them that feeling of, wow, this is not like the last practice that I called. Number two is having really high quality content, photos and videos of you and the team and the practice. User generated content and testimonials are really, really powerful, especially if you can have them talk about what the experience was like having insurance and coming to your office. Number three was reviews. We talked about how that's the original form of user generated content, having those comments about not just nice team, but if they speak to the treatments they did and how this is not like the regular experience they've had in their life before with dentists, and having a volume that separates you from the rest of the pack. All right. So if everybody's got 50, you want to have 100, 200, really invest into it and invest into a tool so that it's automated. You're not leaving it up to luck or people's busy schedules to make sure that this happens. And the bonus, the tip was the membership plan and how much value it drives for the practice. It increases retention, it increases production per patient. And there are tools like Subscribely that allow you to have all of that without having to manage the plans by hand in an Excel sheet or something like that. And I think my final thought, Eric, when I've had this conversation before with some clients about going fee for service and what does it mean, I like to paint this picture. Think about what you're asking from a patient to come to your practice in a fee for service environment. You're asking them to find you online and book an appointment, keep their appointment, show up on time, come to the back, sit in the chair and be a good patient and not be fussy. You're asking them to then leave and go to the front desk and pay whatever your UCR fees are or your normal cash fees are without fussing about it, trusting, paying up front, trusting that the insurance is going to reimburse them, trusting that your team is going to do the paperwork correctly and all of those things. And then you want them to leave and you want them to give you a Google review, give it a really good one with lots of comments and, a lot of passion there. And then you want them to come back to the practice some other day in the future to record some testimonials for you and you want them to tell their friends and family about you. So you're asking a lot of this person. So I think what you need to ask yourself is, what are you willing to do in exchange for all of that? You have to give them a reason to feel like all that trouble is worth it. And that is not just the care, it's how you make them feel in the experience, because we all have some relationship in our lives that we know that we could probably get it cheaper, whether it be your homeowner's insurance or your banker or your yard guy, it doesn't matter. But there's those people that that you might be paying a premium, but it's worth it to you because you know that if you've ever had a problem or if you ever have one in the future, they're going to stick by you. They're going to take care of you. If you need something, you pick up the phone, you call, they're going to be there for you. And that's what you're trying to create. You're trying to create that loyalty to where the patient is saying, I don't care what insurance plan I have. This is my doctor because they've taken really good care of me. They've done right by me in all those years. And I trust no one else. And so I think that's the bar for fee-for-service practice.
Yep. I agree. Very well said. Well, Andre, that was your how to tactically market and your buy to dental marketing. Thanks so much for jumping on the show with me.
Thanks, Eric. Talk soon.